Nurses are continually seeing patients every single day and need to be able to interact with each patient differently. I believe that good communication and public speaking matters importantly in a nurse's daily life. Communication is the process of sending and receiving information verbally and non-verbally. What we say, how we say it, and what we mean are so important when speaking. About 80% happens through body language, including hand gestures and eye contact, according to Gap Medics in 2016, Importance of Communication in Nursing. Within this speech, I will talk about the effectiveness of good communication while being a nurse, how nurses not only have to communicate with patients, but also their coworkers and doctors, and how poor communication can cause negative effects. Effective communication provides safe, comforting, and high-quality care. Good communication may reduce stress not only on the patient, but yourself, and create an overall well-being for the patient. It provides healthy relationships with you and the patient, or coworkers or doctors, and also prevents any mistakable errors. Verbal communication is not the only way of communicating. It is also realizing and recognizing a patient's feelings. It is important to be patient, polite, and comforting so that the patient may feel at ease while in the hospital. Nurses with good communication can often get information out of the patient quicker and easier if you have good communication, and which then in return makes for an easier and quicker diagnosis, according to Gap Medics 2016 article, Importance of Communication in Nursing. Communicating with patients involves 3 C's: confirm, clarify, and collaborate. Confirm what the patient is feeling, clarify that you understand all the feelings that they have, and collaborate that the feelings that they have will then in return make for a quicker diagnosis. Nurses not only talk with patients, but also need to be able to talk with their coworkers, doctors, and friends and family of the patient in the hospital. Nurses need to practice good communication skills to become better at their job. It is important for nurses to check up regularly on the patients to lessen any anxiety they may have while in the hospital. Nurses need to have a smooth communication channel while at work. This includes that when your shift is over, make sure that you tell the next nurse the patient's medication to their eating schedule. Poor communication can cause chaos, fear, nervousness, confusion, or even breakdowns. According to Bertino K. in 2014 article, Effective Interpersonal Communication, she stated that poor team communication has been cited as the #1 cause of unnecessary patient deaths to medical errors since the 1990s. Bad or ineffective communication can cause problems, double the work, and even endanger the patient. According to a 2016 article, Effective Communicating in Nursing, Theory and Best Practices, it stated in a 2013 Journal of Patient Safety that 440,000 people die each year from medical errors, and 80% of those are because of miscommunication. Communicating is so important. So in conclusion, communication is very important in all jobs and should be practiced. Everyone should become skilled in public speaking. I believe that public speaking and communication matters in a nurse's daily life.